Hello, everyone. Welcome to Everyday Life. Today, we will discuss a topic that few people pay attention to, but is very important. When itching is no longer a minor issue, but could be a sign of serious diseases, even cancer. Many people think cancer only causes pain, weight loss, or lumps. But the truth is, sometimes it's just a strange, persistent itch. In this article, I will clearly explain different types of itching, why they occur, accompanying signs to watch for, common tests doctors usually order, and what actions to take immediately. Why can itching, pruritus, be related to cancer? Itching is a sensation that stimulates the urge to scratch. At a basic level, itching originates from small nerve fibers, C fibers, in the skin or from inflammatory mediators, histamine, cytokines, bile salts, interacting with the nervous system. When a tumor appears in the body, it can cause itching through various mechanisms. Local, tumors growing on surface areas, skin, vulva, anus, nose, directly irritate tissues and mucous membranes, leading to itching, pain, or bleeding. Systemic, paraneoplastic. Some tumors secrete inflammatory or immune-stimulating substances that increase generalized itching without obvious skin lesions. Due to obstruction or organ dysfunction, for example, bile duct obstruction, cholestasis, causes bile salts to accumulate in the blood, resulting in severe itching all over the body. Due to nutritional deficiency, endocrine disorders, or secondary complications, cancer can cause metabolic disorders, anemia, kidney failure, all of which can cause chronic itching. These mechanisms explain why itching can appear in many different forms, from localized spots to widespread itching without rash. However, importantly, not all itching is cancer, but certain types and contexts of itching require vigilance and early examination. Type 1. Itching with yellowing or abnormal darkening of the skin, a warning sign of liver and bile duct issues. Clinical features. Itching is usually widespread, whole body, can be very intense, without typical rash. Patients often describe itching worsening at night or more severe on palms and soles. Accompanied by jaundice, yellow eyes, yellow skin, pale stools, dark urine, fatigue, loss of appetite, weight loss. Mechanism. When bile ducts are obstructed due to stones, strictures, inflammation, or tumors in the liver bile ducts, such as liver cancer or cholangiocarcinoma, bile components, like bile salts, leak into the blood. These substances can stimulate nerve endings in the skin, causing itching often without obvious redness. This is called cholestatic pruritus. When to suspect cancer? Severe itching with rapidly progressing or unusual jaundice, skin darkening mixed with yellow. Weight loss, loss of appetite, right upper abdominal pain, prolonged fever. Suggested tests and management. Liver function tests, AST, ALT, total and direct bilirubin, alkaline phosphatase, ALP, GGT, abdominal ultrasound, CT, MRI of liver and bile ducts. If bile duct obstruction is suspected, viral hepatitis tests if appropriate. If unexplained bile duct obstruction is present, consult hepatology/oncology specialists to assess risk of bile duct or liver cancer. Type 2. Itching around the anus and genital area. Don't underestimate the sensitive area. Clinical features. Localized itching, often with irritation, burning, or abnormal discharge. Frequently recurrent, lasting many weeks, sometimes with bleeding or palpable small lumps. Common causes initially include fungal infections, contact dermatitis, hemorrhoids, genital skin disorders. However, be alert to the following signs as they may suggest malignancy. Persistent itching not responding to standard treatment. Abnormal bleeding, foul-smelling discharge, ulcers, or unusual lumps. Urinary disturbances, pain during intercourse in women, menstrual changes or abnormal bleeding. Related cancers, anal/rectal cancer, may present with itching, rectal bleeding, pain, or a mass sensation at the anus. Genes, cervical, vulvar, vaginal cancers. Early stages often present with prolonged itching, accompanied by ulcers, postcoital bleeding, or abnormal discharge. Necessary examinations and tests. Rectal examination, anoscopy. For women, gynecological exam, cervical inspection, pap smear, HPV testing if needed. Biopsy of suspicious areas if ulcers or masses are present. Lower gastrointestinal endoscopy, colonoscopy/anoscopy, if anal ileal rectal symptoms exist. Type 3, itching inside the nose, ears, or throat, when the natural cavities speak up. Clinical features: itching or irritation sensation in the nose, nasal cavity, back of the nose. Itching in the throat, dry throat, need to clear throat. May be accompanied by persistent one-sided nasal congestion, nosebleeds, reduced sense of smell, tinnitus, headaches. In severe cases, visual disturbances or cranial nerve palsy. Common causes include allergic rhinitis, sinusitis, nasal polyps, or chronic inflammation. However, if symptoms are unilateral, persistent, and unresponsive to treatment, consider tumors in the nasal sinuses, nasopharynx, or deeper tumors compressing nerves. Signs requiring immediate ENT specialist consultation. Persistent one-sided nasal congestion. Recurrent unexplained nosebleeds. Loss or reduction of smell, pain around the eye socket, weight loss. Suggested tests and examinations. ENT examination with endoscopy. CT or MRI of nasal sinuses if suspicious lesions are found. Biopsy if abnormal mucosal lesions are present. Type 4, widespread, prolonged itching of unknown cause. Systemic signs, consider lymphoma or hematologic diseases. Clinical features: generalized itching lasting weeks or months without characteristic rash, unknown cause, sometimes worse at night. Accompanied by systemic symptoms such as low-grade fever, night sweats, fatigue, unexplained weight loss, swollen lymph nodes. Possible diseases: lymphoma and some other hematologic diseases, leukemia, myeloproliferative disorders, can cause systemic itching. In some cases, itching appears before other obvious tumor signs. Other causes include metabolic disorders, kidney or liver failure, endocrine diseases, medications, and chronic dermatologic conditions. Initial tests and screening: complete blood count, erythrocyte sedimentation rate, ESR, CRP, liver and kidney function tests, thyroid function tests. Examination for peripheral lymphadenopathy. If needed, chest abdominal pelvic CT to assess mediastinal and abdominal lymph nodes. If lymphoma is suspected, lymph node biopsy. To differentiate, 6 points to help you know if itching might be cancer-related. 1. Duration: itching lasting more than 6 weeks, not relieved by standard treatment. 2. No rash or nonspecific rash. Generalized itching with normal-looking skin is a warning sign. 3. Accompanied by systemic symptoms: fever, night sweats, fatigue, weight loss. 4. Unusual location: persistent one-sided nasal itching, anus, vulva with ulcers or bleeding. 5. Age and risk factors: older age, cancer history, occupational exposure risks, viral infections, HBV, HCV, HPV, require more caution. 6. No response to standard treatments: antihistamines, topical corticosteroids, antifungals. If symptoms persist after multiple treatments, see a specialist. Doctor's examination process: what you should know before going to the hospital. 1. Thorough medical history: onset time, localized or generalized, factors worsening or relieving, current medications, liver, kidney disease history, accompanying symptoms. 2. Physical exam: check skin, mucous membranes, peripheral lymph nodes, liver and spleen. gynecological/rectal exam if appropriate. 3. Basic tests: blood count, liver kidney function, liver enzymes, bilirubin, ESR, CRP, thyroid function, infection tests, HBsAg, anti-HCV if needed. 4. Imaging guidance: abdominal ultrasound, CT or MRI of suspected areas, nasal sinuses, liver bile ducts, chest abdomen, gastrointestinal endoscopy, cervical screening as indicated. 5. Biopsy if needed. Any unexplained mucosal lesions or abnormal lymph nodes require biopsy for definitive diagnosis. Temporary treatment and symptom care at home. Quick itch relief. Bathe with moderately warm water. Avoid irritating soaps. Moisturize regularly. Avoid vigorous scratching to prevent skin damage. OS. Medications: antihistamines for allergy-related itching, topical immunosuppressants for dermatitis, specialized anti-itch drugs as prescribed by doctors, e.g., the mu-opioid channel blockers or cholestyramine for cholestatic pruritus. Psychological support: chronic itching affects mental health, causing anxiety and insomnia, so seek psychological support if needed. Note: do not self-administer systemic corticosteroids or strong drugs without doctor's prescription, as they may mask symptoms and worsen underlying diseases. Common misconceptions and how to avoid confusion. Itching equals cancer. No. Most itching is due to benign causes: allergies, fungi, dry skin. The goal is to recognize when itching goes beyond benign patterns. Home treatment not working. If proper treatment, prescribed sufficient duration, does not help, revisit the doctor. Fear of biopsy. Biopsy is an important diagnostic tool to distinguish benign from malignant inflammation. Early diagnosis helps effective treatment. Main message for you: itching can be harmless, but can also be an early warning sign of serious diseases, including cancer. The 4 types of itching we analyzed: itching with jaundice, darkening, prolonged itching in the anus, genital area, itching in the nose/throat/ears with unilateral or recurrent symptoms, and widespread unexplained itching, all deserve more attention than usual. If you or your loved ones have any of these signs, do not hesitate. See a specialist for comprehensive evaluation. Thank you for watching. If you find this video useful, please subscribe to the Everyday Life channel. Like and share the video so we have more motivation to make more accessible and easy to understand health topics. Wishing you success and good health. See you in the next videos.